Monitoring and evaluation of supply chain health logistics. Overview on Chapter 9, Key M&E terms. Monitoring. Routine collection and analysis of measurements or indicators to determine the ongoing progress toward objectives. Evaluation. Periodic comparison of objectives with accomplishments to determine how well the objectives were achieved. Feedback. Presentation of information to decision makers or lower level personnel based on information received. Why do we do monitoring and evaluation? Monitoring and evaluation is important to provide feedback and report results, mobilize resources, financial, human, capital, etc. Improve program management and system performance. Development of an monitoring and evaluation M&E plan. There are steps followed in developing an M&E plan. 1. Conducting an assessment and using findings to develop recommendations. 2. Developing goals and objectives for the program's work plan. 3. Identifying and prioritizing interventions for achieving goals and objectives. 4. Developing indicators that can highlight whether interventions, objectives, and goals have been achieved. Why is quality monitoring a continuous process? Changes in the organizational environment and policies can affect the supply chain. Example: health sector reform, integration, privatization, cost recovery. Changes in resources, financial, human, capital, that are available to the system can affect the supply chain. Adding new services with new commodities, which may have different storage and distribution requirements, can affect the supply chain. The main steps in developing recommendations include the following. Develop a joint summary of the key points and observations, example: strengths, weaknesses, opportunities, and threats. Identify key existing conditions or circumstances that will influence the choice of objectives and interventions. Compare results to past assessment findings to highlight the reasons for any significant changes, including assumptions that did not work. Outline recommendations for the system strengthening. Examples of data collection tools. The Logistics System Assessment Tool, LSAT, it is one example of a qualitative data collection tool. It is both a diagnostic and monitoring tool, and can be used to evaluate an entire national supply chain and the system's environment. Staff analyze the collated information to identify strengths, weaknesses, and opportunities for further inquiry and/or appropriate interventions. The Logistics Indicator Assessment Tool, LIAT, it is a quantitative data collection instrument. It is used to conduct a facility-based survey to assess health commodity, supply chain performance, and commodity availability at health facilities. You can use the LIAT to monitor the performance of certain processes involved in the logistics management of health commodities, over time, to evaluate certain outcomes of supply chain interventions, to conduct ongoing supervision and performance monitoring, and to monitor commodity availability. Principles of SMART: objectives and indicators. Specific. The objective clearly speaks to the single problem that it is intended to address. Measurable. This includes benchmarks, or points of reference, that can be used later to compare results. They are not necessary to be percentage or number appropriate. The objective is related to and clearly supports the goal. Realistic. The capacity and resources are available and can be used to reach the objective. Time bound. Objectives are planned over time to ensure that they can be met and are measured within a specific time frame. It is not necessary to set time frame for work plan structured projects. What happens during an evaluation of a supply chain? Essential things happens and assessed. 1. The entire system's strengths and weaknesses, commodity availability, and other key logistics indicators are assessed. 2. Assessment results are presented to senior managers and policymakers. 3. Recommendations for reducing or eliminating weaknesses are presented. 4. An implementation plan with specific steps, based on the recommendations, is proposed. Recommendations. To give recommendations, you should define the problem, state the consequence of the problem, suggest a course of action to solve the problem, identify who should take action on the recommendation, identify the resources required. Identify the time frame. Leave a list of expected outputs. Then list the expected and outcomes. Logistics data sources. Logistics data may be found on different levels by different methods. 1. Data can be collected during routine monitoring, using systems that include the LMIS, Logistics Management Information System, or supervision system that provides a reliable source of routine data. 2. Data also can be collected using periodic evaluation. It is done less frequently than monitoring. 3. Data also collected to determine how the supply chain is performing top to bottom, from central level interviews to facility-based surveys. Purpose and the information content of feedback reports. Feedback reports provide information to stakeholders up and down the supply chain. Lower level personnel. Feedback reports provide information help managers to make operational decisions and monitor the performance of the system. To learn how the system is working at every level. To motivate employees, improve performance, and indicate any problems in the reports or the stock levels. Thank you. Prepared by Thierry Ingebier. Awarded a Bachelor degree of Science in Biotechnology. If you like this video, please subscribe, like, share, leave a comment and follow Instagram and Twitter accounts at _Thierry8.